all for joining. I know how busy everyone is, particularly kind of coming back from spring break and with a beautiful evening and sports schedules and all of that. But I really do appreciate it. My name is Tom Peterson. I'm the CEO of Blackbird Health. I'm joined by Mark Lender, who leads our market here in Northern Virginia, and Caitlin Kolba, who is one of our therapy managers, who's really the main event. I'm the teaser at the beginning. I wanted to just start things off by giving a little background on me and why I'm involved in Blackbird, and then what Blackbird does in the area. For those of you I don't know, I do know a few of you on the call. I've lived in Vienna for 30 years or so. I have 5 kids, 3 of whom have come through Madison, 2 of whom are in elementary school and will eventually be coming through Madison. And so I love this community. And one of the reasons that I'm involved in Blackbird is that during COVID, I had all of my 5 kids home with me during COVID, and 3 of them had some pretty significant challenges with the mental health care system. I actually had training as a mental health counselor mid-career. I've run several businesses, but I was largely home with them during COVID, and ended up, and a couple of you know some of this story, but I ended up being a kind of full-time care manager to my kids. And the experience that I had with my kids who were struggling with mental health was not an issue of access, which is so commonly described as one of the challenges with mental health. It was really one of a lot of trial and error. And the example I give is that mental health and psychiatry is really the only medical field where we still use the term, we're going to trial you on a medication, because the success rate is so low that we assume we're going to try you on something else. And that's because every human is different, every circumstance is different. There's a lot that is below the symptoms that really lies beneath what you see on the surface as a symptom. And my experience with the mental health care system was there was a lot of trial and error. So I have my oldest daughter who's now doing great, but during that period was on 3 different failed antidepressants and had a lot of suicidality and cutting. And my now 9-year-old was kicked out of 3 different preschools, was on a path of being labeled an oppositionally defiant kid. And I was just sort of pulling my hair out, and would go and I got a neuropsych eval from my 9-year-old and paid $5,000 for it, and was left to kind of coordinate care across multiple different disciplines. And so what I started looking for was a care model that had addressed this issue of trial and error, and was really looking to find what was below the immediate symptoms, and not only treating the symptoms, but treating what lies beneath it. And so we're going to talk today about anxiety. And it may seem like anxiety is a straightforward thing. I mean, we all experience anxiety, but what we know at Blackbird is that there can be a lot of different root causes to that anxiety. There can be nutritional root causes. There can be sensory motor and root causes. There can be speech and language root causes. There can be cognitive root causes. Can be attentional root causes. And so it really is important to understand kind of what lies beneath, and that's what Blackbird is really all about. And so I ended up getting my kids into care with Blackbird, and it was through this, what we call our Understanding First treatment approach, where we really try to identify what lies beneath the symptoms, and then treat that underlying root cause. And we offer a whole range of assessments, from psychiatric evaluation, autism evaluations, ADHD testing, your traditional biopsychosocial evaluations, and then a full range of treatments. So we have speech and language assessments, occupational therapy assessments, and then we have multidisciplinary teams that then address whatever that root cause is that we're addressing. And it may be as straightforward as a child has anxiety and needs to go straight to therapy, and that's what we'll do. But from my perspective, in the way that the outcomes were so different with my own kids, most of our clinics, and Caitlin is one of them, are in Pennsylvania. We have 5 clinics in Pennsylvania. But when I took over as CEO about 2.5 years ago, and I took over as a result of my personal experience with the clinical model and with the clinicians at Blackbird, that I decided that I really wanted to help get it out into as many communities as possible. One of the first things I did was we launched a clinic in Tyson's Corner because I wanted to bring it in. I frankly had so many friends who were like, can we access these services? And I was like, well, we're not licensed at the time in Pennsylvania. So now in Virginia. So now we have, upwards of 35 clinicians that are licensed in Virginia, and we're, doing our best to serve this community. So that's a little bit about me, why I'm excited about Blackbird in the community. I'm going to hand it over to Caitlin, who's really going to talk a bit more about anxiety specifically. But since I'm a neighbor, may see me at Cafe Amore, working out of my my home office in Cafe Amore. I just wanted to introduce myself, tell you a little bit why I'm involved in Blackbird, why I'm excited for the work we're doing in the community, and then hand it over to Caitlin to talk a little bit more about anxiety. But thank you all for joining. I know your time is precious, and we really appreciate the opportunity to speak with you and share a little bit about what we know about anxiety. So Caitlin.
Thanks, Tom. So my name is Caitlin Kolba. I'm a licensed clinical social worker and a certified clinical trauma professional. My counterpart, Patrice, is not able to be here with us tonight. I've been working in the mental health field for 13 years. I joined Blackbird in 2024. Ironically enough, prior to 2020, I actually grew up in Fauquier County, not too far from that area in Virginia, so pretty familiar. And now I'm located in our Pennsylvania areas. So I joined Blackbird because I really liked the unique approach, the ability to, blend neuropsychology, comprehensive integrated treatment model, kind of what Tom was saying, where many options for people are so disjointed, but Blackbird really brings everything together. We have an all-encompassing umbrella of a lot of different services in one place to kind of limit some of those barriers for people. So, I really love being able to see some of these strategies click for kids and families, and hopefully this presentation is helpful to kind of recognize when children may need some support with anxiety and how we can offer that support and some things to look out for. So why are we talking about anxiety at all? Anxiety disorders are the most prevalent psychiatric conditions among children and adolescents. So we are looking at nearly 1 in 12 children and 1 in 4 teens experiencing clinically significant anxiety. These disorders encompass a range of conditions. This can show up as generalized anxiety disorders, social anxieties and phobias, separation anxiety, lots of different ways that can manifest, and we'll talk a little bit about what that looks like today. So as far as what we'll cover, we will explore the root causes of anxiety in children. Anxiety can stem from a variety of factors. This can be genetics, environmental stressors, developmental changes. We will discuss some practical evidence-based strategies to help children manage their anxieties and explore the importance of creating a supportive environment that fosters a sense of safety, predictability. We'll also look at ways to build resilience, how to equip children, but also us as parents with the tools that we need for long-term emotional well-being. So the goal by the end of this session is that you'll have a deeper understanding of childhood anxiety, practical ways to help support your children effectively, and strategies to nurture that resilience. Anxiety is a natural and necessary response to stress or danger. It's our body's way of preparing to face a challenge, whether that challenge is real or perceived. Most of us have experienced anxiety to some degree, whether that's a big presentation at work or even as we were growing up, test anxiety, performance anxiety, uncertain social situations. So when we are talking about anxiety, it really is that anticipation of a future threat. A lot of times we'll describe anxiety as a feeling of worry, nervousness, or unease about an uncertain outcome. This can range from mild discomfort to overwhelming distress. Anxiety shows up in different ways in different people. So it is important to realize that anxiety is not always negative. It does serve a very important function in keeping us alert, safe, prepared, aware of our surroundings, heightens that sensitivity to pay attention to what's going on around us to make sure that we're safe from danger. So there are typically 4 responses to perceived threats: fight, flight, freeze, and a relatively new one, which is fawn. So fight, flight, and freeze typically activates the body's survival mechanisms. This prepares us to respond to perceived threats. It involves physical changes like a faster heartbeat, heart beating against your chest very strongly, tense muscles, increased alertness. These are kind of the 4 primary stress response mechanisms. And during that fight response, the body is preparing to attack that perceived threat. So it actually pulls a lot of blood into your core, gets you ready to, show up in a way that may look like physical aggression, anger, hypervigilance. The flight response, the body is typically preparing to escape that perceived threat. So that can look like restlessness, panic, literally running away. When a person exhibits the freeze response, the body is typically slowed down in motion or completely unable to move or to act out against that threat. And this can look like actual physical paralysis, emotionally shutting down, dissociating, emotionally showing up that they are numb. And the newest addition being the fawn response, which is when our body tries to portray itself in a certain way to please other people, to minimize any potential conflict or avoid any kind of pain. This can look like people pleasing, codependency, conflict avoidance. I really like this diagram because this helps show how anxiety symptoms intersect and where the similarities and differences lie between different age groups. So while there are some parts of this that are very specific to different age groups, there are a lot of things that lie in the middle that we can understand from our point of view as adults and parents, but also there are some things that kids experience that we don't. So as far as when it becomes a problem, I think the biggest question is what's normal versus what would be considered excessive. Anxiety is normal in small doses, like we said, but when it is persistent, intense, overwhelming, it's disrupting daily life, it may signal some kind of anxiety disorder. If it's consistently affecting someone's emotions, thoughts, behaviors, physical well-being, causing a lot of distress or disruption, those are times where we may need to start to think about it in a little bit of a different way. So some common triggers for anxiety, we have these separated out for children under 10 and children 11 to 17. As I said within that diagram, there are a lot of intersections, but these are things that typically fall into these age ranges. So children under 10, I would say some of the top triggers that we are seeing across the nation and within our clinics for triggers for anxiety would be separation anxiety. That shows up as fear of being abandoned by or even just apart from parents, or even the idea that if they are apart from their parents or caregivers, that something bad might happen to them or to those caregivers. Fear of the unknown. This looks like anxiety about new experiences, environments, new people, things that are unfamiliar. Performance pressure, fear of failing in school, not doing as well as they would like in sports or in after-school activities. And specific phobias. This can look like fear of specific animals, fear of illness, darkness, sleeping alone, loud noises. Children 11 to 17 are facing more social pressures, fear of judgment, rejection by peers, academic stress, pressure to perform well in school, to meet parental expectations, school expectations, to get into a good college, body image concerns, concerns about appearance, physical stature, dealing with hormonal changes, doing the social media comparison game, and future uncertainty, worrying about what college will look like, if they'll get into a good school, what they want to do for career, if they even want to attend college, if they're looking at other options and what their life goals are. Each of those things can bring about a lot of anxiety for these 2 different age groups. So while those are some of the common triggers for anxiety, we also see a lot of unexpected causes of anxiety. And one of the things that really stands out to me is the food sensitivities unexpected cause, because this was a specific client that I worked with personally. This was an 8-year-old individual who was showing up in the clinic with frequent stomach pains. They were going to the nurse several times a week, exhibiting high anxiety, really intense fear of throwing up, of potentially vomiting in class. And after doing some testing, our nurse practitioners referred them for some lab work, followed up with the doctor. We learned that there was actually a dairy sensitivity causing an intestinal backup that was causing a lot of stomach pain, nausea, discomfort. And that pain and discomfort and unsettled stomach was actually being perceived as anxiety symptoms. And once that was addressed, this kid hardly presents with anxiety. Anything outside of, testing and things like that, the fears that were there before have significantly reduced. So that can be something to watch for. That can definitely lead to a heightened stress response. Another unexpected cause of anxiety, parental stress. Children absorb our stress as parents. We've had individuals where, as the family dynamics change, parents change jobs, the kids are unsure what the schedule is going to look like. They're not always able to articulate that they're feeling stress from whatever is changing with their parents, or noticing that the parents are stressed. But that change in schedule or the change in stress in the home environment can definitely increase stress in kids sometimes. Sleep deprivation. If we're not sleeping well, we don't handle stress well. That applies to kids and for us as adults. So lack of adequate sleep definitely disrupts our emotional regulation. Social media, as I mentioned, with the body image concerns, that can definitely lead to some unrealistic comparisons. That's also constant stimulation, especially if it's before bed. As far as hormonal changes go, fluctuations in hormones, especially during puberty. I think we all have kind of noticed that as our kids get to that age, sometimes they are more emotional, quicker to snap or to respond, dealing with some heightened anxiety about new changes and things that may happen. And a lack of downtime. We're busy and our kids are busy. And sometimes not having time for rest or self-regulation, this just increases the stress. Sometimes we need to be human beings rather than human doings, but we are not always in an environment for that to happen successfully. So other diagnoses that may manifest as anxiety, I know Tom mentioned a few of these in the beginning. So social pragmatic disorder. This looks like difficulties in understanding and responding to social cues, difficulties interpreting nonverbal communication, navigating social interactions. This can make kids feel pretty frustrated, isolated, and really dealing with like a fear of making mistakes in social situations that can lead to a sense of anxiety. Intellectual disabilities and cognitive delays can contribute to anxiety by causing individuals to struggle with processing information quickly. So that can lead to feelings of being overwhelmed, inadequate, unable to keep up. Learning disorders can cause anxiety by creating a constant feeling of frustration and inadequacy due to the difficulty of keeping up with peers academically or feeling different, feeling behind. This can look like anxiety about completing schoolwork, anxiety about social situations and interactions where they just don't even want to go to school at all, self-esteem challenges, and anxiety from the stress of trying to understand concepts that are just very difficult for them to grasp at the moment. Speech and language disorders make it difficult for children to communicate effectively with their peers. This can lead to frustration, isolation, anxiety about social interactions. We did have another individual within our program who presented with a bit of a speech delay. And while they were working on that through speech and OT services, we found that as much as she liked to talk about her day, she really struggled to be able to communicate in the way that she wanted to. And initially, she was kind of written off a little bit as a late bloomer, that she would just come around to it, but she just continuously got more and more frustrated when she wasn't able to communicate what she wanted to, and it was showing up as behavioral concerns. when in reality, it was a lot of anxiety about not feeling like she fit in, not feeling like she was able to adequately communicate what she was feeling or what she was trying to say. And through additional services, as that improved, the anxiety reduced. Poor memory can also manifest as anxiety, both in children and honestly in adults as well. It causes the person to worry excessively about this cognitive dysfunction or the inability to remember things well. The anxiety then further impairs memory function. When we're feeling anxious, we're not thinking clearly. So that tends to just create a cycle. Medical conditions. This can contribute to anxiety in childhood by causing a lot of feelings of fear, uncertainty, and lack of control, especially if these conditions hold symptoms of physical pain, if there are invasive procedures, disruptions to daily life, or threats to their health or to their family, especially when the individual themselves or their parents or a loved one are dealing with chronic conditions, frequent hospital visits, or treatments that they perceive as scary, painful, or risky. So this can lead to just a heightened state of worry and anxiety about their health or their well-being. And ADHD. ADHD and anxiety often go hand in hand. They are not the same thing, but I think a lot of times they are co-diagnosed together. ADHD can manifest as anxiety when the brain struggles with the executive functioning tasks. Those would be time management, remembering to complete tasks, staying organized, meeting deadlines. Having trouble with those creates a constant sense of stress and overwhelm. So people with ADHD may feel anxious about forgetting important things, missing those deadlines, struggling to keep up with responsibilities. Hyperactive thoughts, impulsivity, and sensory overload can contribute to feelings of restlessness and worry. So over time, this chronic mental load can definitely mimic or fuel anxiety. So addressing underlying ADHD symptoms are really helpful to address the anxiety that comes along with that. So long-term impacts of anxiety, if it is unaddressed or if it has been going on for quite some time. On the mental health side of things, we are looking at the potential for chronic stress. When anxiety becomes chronic, the body stays in a constant state of stress. So this leads to long-term issues, sleep disturbances, waking up in the middle of the night, struggling to go to sleep, struggling to stay asleep, digestive problems, unpredictable stomach, irritable bowel, food sensitivities that didn't exist before, even increased risk of heart disease. The brain remains in fight or flight mode in a state of constant stress. So it makes it even harder to relax, harder to think clearly, and coping with everyday stressors feels like coping with something very challenging. Co-occurring disorders. Anxiety often does not exist alone. It commonly coexists with other diagnoses, as I said, like ADHD, but this can also show up alongside depression, obsessive compulsive disorder, and a number of other diagnoses. This can make treatment more complex. So as symptoms of one disorder fuel the other and create cycles, it can mean higher levels of intervention may be needed. And low self-esteem. Over time, persistent anxiety can lead to self-doubt and negative self-talk, making individuals feel incapable or unworthy. And over time, this just continues to erode confidence and can really discourage people from taking risks or trying new things. Long-term impacts of anxiety on relationships over time. People with chronic anxiety often avoid social interactions due to fear of judgment or embarrassment. This can lead to loneliness, isolation, and difficulty forming close relationships. It can show up in conflicts with peers. Anxiety can make individuals more irritable or sensitive, leading to misunderstandings and conflicts with friends or classmates or parents. Overthinking social situations can also cause unnecessary worry about how others may perceive them. And family tension. Anxiety can create strain between family members. Parents may struggle to understand their child's anxiety, while siblings may feel neglected or frustrated. And in some cases, anxious individuals rely heavily on the family for reassurance, which can create tension and sometimes burnout, both within caregivers, parents, and extended family as well. And academic performance. When we are in a constant state of anxiety, it makes it very hard to focus. The brain is very preoccupied with worry. Tasks like reading, listening to instructions, or completing assignments can become really overwhelming, and this can lead to procrastination, difficulty retaining information, and just avoidance of academic tasks altogether. So declining grades, as concentration and motivation drop, academic performance suffers. Students who were once high achievers may struggle to keep up. This decline can then trigger self-doubt, reinforcing that cycle of academic stress. And school avoidance. Some students begin to avoid school altogether due to anxiety about tests, social interactions, or speaking in class. This leads to missed learning opportunities and difficulty reintegrating back in later on. So we're now going to look at how parents may unknowingly incite, model, and reinforce some of these cycles of anxiety. Parental accommodation. What it looks like is constantly stepping in to solve problems or to shield our children from discomfort. So one example that I have would be a parent that notices their child experiences extreme anxiety when going to school. So to avoid that distress, to avoid the morning fights, to avoid really pushing the child to have to experience those feelings, the parent allows the child to stay home whenever they're feeling anxious, reassuring them it's okay, you don't have to go if it makes you upset. But over time, the child starts relying on staying home as a coping mechanism rather than building resilience and learning how to handle these anxiety-provoking situations. So by accommodating their avoidance, we are unintentionally reinforcing the idea that a particular person, place, or thing is something to fear, preventing them from developing the coping skills they need to gradually face those fears. And an example of parental inconsistency would be setting an expected bedtime routine to help an anxious child feel secure, to develop good sleep habits. But some nights we are tired as parents. We don't feel like we have the energy to reinforce that bedtime routine. So some nights it is strictly turn off electronics. We read a bedtime story. It's a calm environment. It's very structured. Other nights, we allow them to stay up late watching TV, stay on an iPad, go to sleep with that in their hands because we are too tired to enforce that every night or to go through the fight of it. It's unhelpful because this inconsistency can create confusion for the child, make it difficult to establish a sense of predictability and security, which are really essential for managing anxiety. This also can lead to kids that want to push boundaries, knowing that the rules are not always consistently enforced. Overprotectiveness looks like restricting independence or taking excessive precautions. So an example may be accompanying our middle school age or early high school age kids to birthday parties, social events, even when other kids may attend alone. We are frequently reminding them, be careful, checking on them, warning them that things could go wrong. This really sends the message that the world is unsafe and kind of can create a fear of risk taking. And parental anxiety. So as I said, a lot of anxiety is normal anxiety, and each of us deals with that in a different way. Sometimes when we openly worry and we exhibit that stress unmanaged in front of our kids, expressing frequent worry, especially about something to do with them, such as, did you study enough? What would happen if you fail this test? Did you put in enough applications? What if you don't get into a good college? I don't want you to struggle like I have. Filling the time and the space with those sorts of statements. Our kids absorb that anxiety and they start to mirror our stress and our own patterns of worry, even when really we're trying to be helpful and we're just trying to express how we may be dealing with our anxiety. So now that we've explored some unhelpful parenting patterns that can contribute to their anxiety, we're going to focus on some practical strategies to shift these patterns in a positive direction. So to reduce parental accommodation, we would look at gradual exposure to fears. We have some examples, like a fear of dogs. That gradual exposure may look like looking at pictures together, watching some clips online, gradual process of exposure more and more, visiting a park and observing them from a safe distance, eventually introducing them to your friend's really calm and well-trained dog, just really building up that exposure and that confidence with support and encouragement. And similar situation with test anxiety. If we have a kid who's really struggling with test anxiety, we may have to walk it back a few steps, review a few practice questions in a quiet, low pressure environment at home, gradually increase the difficulty and duration, kind of simulate the test at home, begin to introduce light distractions like background noise, light changes, people moving around them, and eventually having them complete a full-length practice test to help build some confidence and familiarity with that experience. We can also skill build through practice and role play. So this can look like encouraging kids to ask for help in the store, really practicing at home, role playing tough conversations, whether making a phone call, calling a college admissions office, interacting with adults in public, and really just helping them step by step gain some confidence in that practice. And responding to teasing or bullying. There can be some role play opportunities there as well, helping our kids practice assertive but calm responses like, I don't like when you say that, please stop, I find that disrespectful, I am no longer going to engage in this conversation, and helping them practice that and also modeling that for them in our interactions. So enhancing supportive resources, we as parents want to validate feelings and offer support. There can be a lot of anxiety in many of the situations we've talked about already. And just in some of these examples, if a child is nervous about starting a new school, maybe they're moving from middle school to high school or going from high school to college, acknowledging their feelings with statements like, it's completely normal to feel a little bit nervous. Let's talk about what you're excited for. Let's talk about what feels scary. Let's create a plan together. Let's visit it in advance. Let's, research your professors. Let's talk about different ways to make friends, different clubs you want to join. Really just validating those feelings and offering support to reinforce that these feelings will ease with time. And same thing with trying a new activity. Validating. It makes sense to feel a little bit nervous before trying something new. Lots of people feel that way. Let's think about what you're looking forward to and some tools you can use if you do feel overwhelmed. And encouraging confidence through those past successes. Trying out for a team, reminding them of their effort and their preparation. I know you've been working hard on this. I see how much you've been improving and working. Trust yourself. I trust you. I'm here with you. And facing public speaking. Remember how nervous you were before your last presentation? You prepared well, you're stronger than you think. Encouraging them to reflect on what helped them to succeed before. We can model and assist them with developing skills for independence. So deep breathing practice can be a really helpful tool both for us to regulate when we're feeling anxious or frustrated in a moment and when we're trying to teach that to our kids. So really kind of teaching them breathing in for a count of 4, holding for a count of 4, breathing out for a count of 4, those types of regulation that can happen together. And gradually introducing some other techniques. There are a lot of different techniques that we teach to kids and families here at Blackbird. Modeling mindfulness and journaling, sharing your own personal strategies for managing your stress. Sometimes I use a mindfulness app, or sometimes I do some journaling, or I go for a walk. Sometimes I realize I'm getting overwhelmed and I take a break to walk away. Really sharing those things with our kids can be a great way to help model that communication. Same thing when we're running late or dealing with unplanned changes. They see what we're doing and our interactions with them and our reactions to that stress, anxiety, or unplanned things that come up. So being able to just acknowledge, I know we were really looking forward to today going this way. Let's think of something fun we can do instead. Let's problem solve, take a deep breath. What's our next step? and encouraging independence in those everyday tasks. So this can be giving younger kids more and more responsibilities, teaching them how to pay the cashier at the grocery store, promoting independence in older kids. I think you're ready to start packing your own lunch for school. Would you like some ideas, or do you want to give it a try on your own? Support the efforts without taking over to allow them to develop some confidence in their ability to manage tasks. And teaching problem-solving skills. So sometimes kids forget to complete their homework, and we get frustrated because they know they're supposed to do their homework. What can we do to help you remember next time? Do you think a reminder on your phone or a checklist might help? Encouraging them to take ownership of their organization by brainstorming some strategies that may work for them. And helping resolve conflicts with friends. When they're facing a disagreement with a friend, we want to jump in and solve the problem, but sometimes asking things like, what do you think went wrong? What do you think your friend is feeling? What's one thing you feel you could say that may help fix this situation? These can encourage the child to think about solutions that may promote healthy communication, empathy, and problem solving. And building resilience. We are looking to help celebrate efforts of bravery, not just outcomes, and to teach that self-compassion and reframe negative thoughts. So there are examples of swimming hesitation, trying new foods. Sometimes we want it to be successful so much that we say, well, but it's taking you forever. You really need to just sit down and do this. When in reality, really just acknowledging you gave it a shot. You tried it. Maybe all you did was lick the spoon, but I'm proud of you for trying it, and helping them associate that effort with positive reinforcement. Learning to ride a bike, even just speaking up in class, being able to acknowledge when they come home and say, I actually raised my hand today. That was a big step. I know it wasn't easy, but I'm super proud of how you're pushing yourself. Same thing with making a new friend, overcoming homework challenges, acknowledging, this was hard for you. And I know you had a tough time, but you really stuck with those tough problems today. And I can see how you're improving. So our responses and how we show up and how we acknowledge that effort goes a really long way. So next we have some tools and resources for parents. So one of the big questions as we're talking about anxiety and what's considered normal anxiety and what's not is when to seek professional support. So you believe that your kid may be experiencing some anxiety. You're starting to ask questions of, well, I'm doing these things. I'm offering support. I'm offering validation. I'm holding space. We've learned some skills, but when do I need to reach out and get some additional support? There are a few key points to this. When the anxiety is becoming persistent and severe. So when anxiety is interfering with daily life, it's impacting school attendance, friendships, family activities, there's a real avoidance of doing a lot of things they were maybe doing before. It's showing up as physical symptoms, like the individual I mentioned earlier with frequent stomach aches, frequent trips to the nurse, headaches, stress-related health complaints without any true medical cause. Excessive avoidance, avoiding age-appropriate activities or responsibilities due to fear, not wanting to go to school, suddenly wanting to bail out of baseball practice, not wanting to go to social events. Emotional dysregulation, frequent meltdowns, if they're expressing excessive worry that doesn't seem to calm down, or they're having really big responses to really small triggers. And paying attention to the duration and the escalation. So anxiety that seems relatively normal and manageable, but is really persisting for months or worsening despite support and accommodations at home or school may indicate that it's time to get some professional support. And the other big question is, when do we seek support as adults and as parents? If we are struggling to really manage our own child's anxiety, if we're feeling really overwhelmed or unsure about how to respond to their fears or behaviors, if we're wanting more tools and more strategies, if it feels like we just don't even know what direction to go in, if we're experiencing our own significant worry about our kids' well-being that's showing up as anxiety for us, or we're feeling a lot of guilt about our own parenting decisions. If the anxiety-related struggles of ourselves are causing arguments or stress between family members, if we're feeling trapped in patterns of over-accommodation, like enabling avoidance behaviors or providing that excessive reassurance, and we're not sure how to shift those patterns, or if we really just want professional guidance on effective parenting strategies to help foster that resilience and independence. So a big thing for us as parents is to make sure that we are taking care of ourselves. A lot of what we've talked about is modeling and replying in a way that requires us to feel pretty grounded and centered. So we've included some things that can really be beneficial for self-care for parents. This can be setting boundaries and practicing self-compassion, recognizing that you cannot solve every problem for your child, and it's okay to prioritize your own well-being. Parenting is not about perfection. It's just about showing up the best we can with love and consistency while taking care of ourselves too, and trying to avoid falling into guilt or self-criticism when challenges arise. So this can look like taking a break when you feel like you need it, setting limits if your child is frequently, asking for reassurance, setting healthy boundaries by saying, I understand you're feeling anxious. I'm here to support you, but I need a few minutes for myself right now. So setting and maintaining those limits and working to reframe our own negative self-talk, that little voice that pops up that says, I should be doing more, and reminding ourselves, I'm doing my best with what I have, and that's enough. Building a support network. Parenting a child with anxiety can feel pretty isolating, but seeking support can provide emotional relief and practical strategies. So I definitely encourage you to connect with others to understand your experience, reach out to friends, family, support groups, professionals, and, if you decide, seeking therapy for yourself so you know how to navigate these emotional demands. Prioritizing your physical and mental well-being. So managing your child's anxiety requires you to stay physically and mentally healthy so that you can help support them in doing the same. Developing routines that support your well-being, so making sure you're getting enough rest, incorporating stress relief techniques like mindfulness or creative activities into your daily life can help manage your own anxiety. This can look like daily movement, exercise, mindfulness, and relaxation practices like yoga, deep breathing, and healthy sleep habits. So setting a bedtime routine for yourself, making sure that you're prioritizing getting enough sleep. Educating yourself about anxiety. So understanding your anxiety is one of the most effective ways to feel more confident as a parent. Anxiety is a normal response to stress, as we've said, but when it feels overwhelming and it's interfering with your daily life, learning about how it works and what helps reduce it allows you to better support yourself and your family. And practicing gratitude and focusing on the positives. So parenting an anxious child can feel overwhelming, but it's important to notice the small wins and to acknowledge progress, even if it feels minor. We encourage a gratitude practice, whether it's keeping a journal, sharing something positive at the dinner table, or recognizing moments of connection. Even just acknowledging progress of you got out the door today and you made it through the day, and that's a big win. So we've included some tools and resources. I'll kind of pause here for a moment just so that everyone can read through, but you'll be able to go back through and see this in the recording. These are some resources, some books that we found offer some really good steps, some really good strategies. And another highly recommended book in general is called The Anxious Generation. So this book really explores the link between the rise of mental health issues in younger individuals and their increasingly online presence. So it talks a little bit about overprotection in the real world and underprotection in the virtual world, as we are all adjusting to the age of the internet and being constantly plugged in and interacting with each other. So today we focused on some key objectives to help us better support children with anxiety. We looked at underlying causes to help us understand what drives these feelings. We learned some practical strategies. And we discussed some ways to build some long-term coping skills, both for us as parents and in empowering our kids. So we are now going to open up the floor for questions. And if anyone has any, I would love to help give you some